This time of the year, it can seem like sickness is inevitable, forcing many people to seek medical treatment. Now, of course, that can overwhelm our emergency departments, but there are evolving solutions to try and help solve that problem. And joining us now here on the CTV desk is the Chief of Staff for RVH, Dr. Jeff Tyberg. It's great to finally meet you.
Nice to meet you. Thanks for having me.
Let's talk about why this time of the year we see that spike in respiratory illness and how that impacts the hospital.
We tend to always see surges of viral illnesses in the wintertime because people are packed closer together. They spend more time indoors. So we're used to that. In the last few years, post-COVID, we now instead of having one virus, which would be influenza, we're now dealing with 3 different viruses, which is influenza, RSV, and COVID. Those preferentially impact older patients. Those patients need to be admitted to the hospital, which strains our capacity and sometimes strains our emergency department.
Okay, well, let's talk about the solution. Can you expand on the minor ailment patient pathway, or pink zone, at the hospital?
Oh, yeah, I'd love to. Something we're very proud of. Our emergency department team and our research team combined to see if there was a subset of patients that could safely schedule the time for their arrival. So this isn't for people with chest pain or a stroke, but this is for people with less serious illness. They're screened and then they're given a scheduled time to arrive. That allows the patient wait to be decreased, and it also allows the team to focus as well on the patients that are more urgent. So it just makes the emergency department work more efficiently and give patients a better experience.
What are some of the solutions outside of the hospital that you would recommend people look into if they do need medical assistance?
So certainly they should follow general public health recommendations, but if possible, if their situation isn't urgent, if they have a family physician and they're able to see them, walk-in clinic, virtual care, nurse practitioner-led clinic, a pharmacist, any of those things might be good alternatives. But I do really want to emphasize, we want people to be safe. If they think that they're suffering or potentially suffering from a serious illness, an urgent illness, or an emergent condition, that's what the emergency department is for. If you have a time-sensitive condition, you'll be taken care of in a timely manner. For some other things, you may have to wait a little bit longer, but you'll get the care you need, and we want people to be safe.
Yeah. How do you find people are reacting? Are people frustrated? Are they embracing this new approach?
I think it's difficult for people, and we really empathize. It's hard to sit and wait, or it's hard to spend time in the emergency department after you're admitted, or be admitted to a hallway. I think our staff, our physicians, nurses, all other staff are working really hard to try to make it as gentle as possible for patients, and I think most patients are really quite understanding of it. We recognize that it's difficult for them, and we have lots of different things that we're doing. We're putting patients in unconventional spaces. We're moving things around, again, to try to decrease the waits as much as we possibly can.
There's been a lot of talk about the evolution of RVH and much expansion. So how is that going to help target this problem specifically?
So one of the challenges that we face in the emergency department is sometimes, even when we use unconventional spaces, there are no beds. We admit people to the hospital, but there's not a bed space to put them in. So those patients sometimes end up boarding in the emergency department, staying in the emergency department until we can find a bed for them. That limits the number of spaces that the physicians and nurses are able to care for the patients in the emergency department, and that increases wait times. So that's why in our really rapidly growing region, one of the things we need and one of the things we're working on is increasing capacity, both at the North Campus in Barrie, where we're modifying units and increasing units, but also South Campus in Innisfil, where we hope to have an urgent care center soon, and then be able to have more inpatient capacity in the South Campus to decrease the load on the emergency department.
Big plans ahead. Thank you so much for coming and joining us in the studio, and of course to you and your team for what you do every day. It's a tough job.
It's been a pleasure. Thank you for having me.
We have been speaking with the Chief of Staff for RVH, Dr. Jeff Tyberg. A reminder that you can revisit our conversation on the CTV Barrie website, ctvnews.ca/Barrie.